Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we had a rather docile, should I say, off-year election, and then we're going to get a little legislative preview with a couple of the state's leading journalists. And what about patient-centered medical home? Boy, this is a fascinating new approach. You're going to hear about it on this show right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, we've got John Micek sitting across from me and Tony Romeo. John is with the Allentown Morning Call. Tony Romeo, KYW, KDKA Radio, frequent guests on the program. All right, guys, look. Docile may be an overstatement for this election. John, low turnout, a couple of big primaries. What's your takeaway?
There was an election on Tuesday. My gosh. What, lower than maybe 20%? If we were super lucky. It was pouring out on Tuesday, too, which kind of discourages people from coming out on the polls. I mean, it's one of these years where off-year elections is hard to draw up interest. But this year in particular, there was no, it was super local. There were no marquee races. And we're getting obsessed now about maybe a Commonwealth Court recount between two Democratic candidates. I mean, that ought to tell you something about the level of glamour in this contest. Yeah,
but before I go to, I want to ask Tony about the Philadelphia mayor's race in a minute. But before I do that, it looked like, for the most part, even though we've got this Commonwealth Court, everybody out there knows the names. I don't even know their names. John's going to have to tell me. Party ruled. I mean, as I looked around the state, not everywhere, but the party-endorsed candidates seemed to do pretty well in both parties, right?
Yeah, I mean, that was the case. I mean, you had Rich Fitzgerald in Allegheny County, the party-endorsed candidate there.
Won handily.
Winning handily. Mayor Mike Nutter in Philadelphia, as Tony's going to mention in a moment, won the Democratic nomination in Philly. In races like this, party rules because regular voters just ain't coming out.
It was so. Milton Street spent a little time in courtesy of the federal government. Where? Come on, you can say it. Federal prison, right? Still owes $1 million or something in back taxes or whatever that is. 30%. What? Go ahead.
Yeah, that's interesting. It doesn't seem to have any implications for the fall elections. It's hard to imagine a Republican really making a challenge to a Democratic candidate in Philadelphia, given the structure and the calculus there in that city, being so heavily dominated. But nonetheless, it is interesting to me that a candidate with as much baggage as Milton Street had could carve out that much of the vote.
His younger brother, John Street, changed his party registration to become an independent, so maybe the Mayor Nutter in Philly will have to run
That is a source of a lot of speculation.
Another street, maybe. We're saying maybe, right?
Maybe.
Who knows? And then the other thing, just in Harrisburg, where this show is taped, the mayor of the city of Harrisburg has her hands full now that it doesn't look like 3 Democrats elected to city council, 2 incumbents, and a new one are not in her camp. So it looks like the mayor is Linda Thompson is in for a rough couple of years.
Yes, it does.
All right. Let's turn now our attention to the legislature returns with a full agenda, as I think both you guys spend a good bit of your time covering Harrisburg. Tony, let's start with you. The budget. House passed the budget, $27.3 billion. Fooled around a bit with education, reduced some of the cuts. Let me start with this question. Republicans own Harrisburg. Do they get it done by June 30? We're pushing pretty quickly.
Well, let me massage it a little bit. I don't believe the House has actually passed the budget yet. The Republicans have proposed it.
Oh, they didn't pass it?
It came out of appropriations.
Oh, it came out of appropriations.
But for all intents and purposes,
it will pass.
It will pass.
Okay.
It's expected to pass. The Republicans
That's why I have you guys on, to keep you straight.
But the reality is that in spite of the fact that Republicans control all the levers of power in Harrisburg, there are some interesting disagreements right now on how the budget is set up. The Republicans are restoring, in the House, are restoring some money to education and higher education, restoring some of the steep cuts that the governor proposed by budgeting for savings in the welfare department that they believe will be found through eliminating errors and fraud, savings that Governor Corbett does not think should be budgeted for. He thinks that they're there, but he doesn't think you can balance the budget
you could
with
even get them out by next year's budget.
And then on the other side, in the Senate, there is this surplus in the current budget. It sounds funny to say there's a surplus, but in the current budget, we're $500 million and counting above projections for this fiscal year that could be put toward what's expected to be a massive deficit in the next budget. And the Republicans in the Senate say we should spend that. Governor Corbett doesn't want to spend that.
So you've got these big differences at the moment. But John, you've been through this. Both of you guys have been through this before. The party, you got one party in power. If they hold ranks firm, they can do pretty much what they want. Yes, no?
Yes.
But go ahead.
I mean, there's this assumption that when the Republicans cleaned up last year, that with big majorities in the House and Senate, everything was going to be fine with Governor Corbett in the governor's office. Just a reminder that all families squabble. I mean, ultimately, there's going to be a budget at the end of this thing. It's probably going to look more or less like what the governor said it was going to look like, and with the House, with the money put back in for higher ed and that kind of thing. Where this could also get kind of hinky is always with these so-called sidecar issues, these bills that pop up that invariably get tied into the budget negotiations. For instance, the Marcellus Shale impact fee and school choice.
I want to talk about those in a minute.
So I mean, that's another place where there could be sort of side stage drama.
All right, we're running to a break. Marcellus Shale, school choice, big issues. They're part of it. Governor doesn't want Marcellus Shale. He wants school choice. Will we get them? Our experts will tell us when we return.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by ReconnectPA.org, supporting a comprehensive transportation funding solution, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back with John Micek and Tony Romeo, both reporters, longtime observers, and chroniclers of all things Harrisburg and state politics. I got that out, didn't I? All right, we got two big things going on. We got Marcellus Shale. The governor says no way impact fee. Tony Romeo, we have the big guy in the Senate. The president pro tem says, I've got a bill. It's an impact fee bill. I want to pass it. What's the situation with that?
Well, just before the break, you made a very important observation, and that is most of the budget impasses we've had during the Rendell years, over the previous 8 years, had to do with the sidecar issues being coupled to the budget, as John put it. This year, I think that the major sidecar issue will be the impact fee. I don't think that school choice is going to happen before the recess, and the Senate Republican leader has basically said that.
What's the issue? So the governor says no to an impact fee. He wants to wait until his commission reports, and then that'll be the out.
Right.
Because they'll probably he doesn't want Senator Scarnati to push that bill.
Right. But he also, there's also this issue of fee versus a tax. The governor made a no tax fee, and I think you have the Senate President pro tem here walking a fine line, trying to paint this as a fee and not a tax, but it's the old story of if it quacks like a tax and walks like a tax.
He's going to have to, John Micek, he's going to have to, the President pro tem of the Senate is not exactly an unpowerful, if that's a word, leader, right? I mean,
if he wants to press this issue, he can certainly press this issue. I mean, where you get into it is the governor said he's willing to examine, he wants to talk about the impacts, he's willing to consider all that, but he wants to make sure that no money comes back to Harrisburg.
General fund.
Senator Scarnati's bill has a provision in it where some of this money would be redistributed for highway and bridge projects and conservation projects statewide. The environmental stuff, and the governor's not into that. So that's another wrinkle there. The House is kind of lukewarm on it as well. They're saying they don't want to do any sort of tax and/or fee increase. You could see some severe horse trading going on there as well.
But the one thing that I've noticed just in following the newspaper coverage, TV and radio coverage of this has energized a lot of people, not just in the environmental community. I think every day we hear about, there's this problem with a well that's leached out, and there are water concerns. Tony, how big a deal does this become? I mean, it seems to me it's growing by leaps and bounds. Am I right or wrong about that?
It's already a big deal, and quite frankly, as we were chatting during the break, as soon as I heard about this Marcellus gas shale formation years ago and what had to be done to fracture the rock deep in the ground to get the gas out, I thought, oh, this is going to be something we're going to be talking about for decades to come.
This just isn't something that's sort of a policy conversation either. I mean, if you talk to people who are sort of outside the very narrow orbit that we all operate in, I mean, there's out there in the wider world within the public, there is no shortage of opinion on this, and there's just mass confusion as to why there's not a severance tax being imposed on these drillers. I mean, this is one of the great policy challenges of the next 10 years, but also it's going to be this great public conversation of the next 10 or 15 years. I mean, people in a way that they don't get engaged in, say, talks over property taxes or over school choice in the wider world are engaged in this issue just because of the environmental implications of it.
So both of you think it's big now and it's going to continue to grow, right?
Yes.
All right. Before you get out of here, I want to ask you about school choice. It's become, voters aren't in favor of it. All the polls show that. Governor Corbett is committed to, taking a piece of state funds, allowing students in poor districts. This is a big deal in the state Senate, where we've got a Democratic senator and a Republican senator, a Philadelphia guy. Tony, I know that you covered Tony Williams and Senator Piccola. They're pushing this very hard. School choice, if it doesn't get done now, Tony Romeo, does it get done at all?
Well, I think it may come up in the fall. Fair chance in the fall. But it is interesting. The week before this show, week before last, the House passed a bill that would expand a tax credit for businesses that donate to scholarships for school children. That was seen by many as, even though the Senate bill, the voucher bill, has that same component to expand that tax credit, the House action was seen as the House being
a finger in the eye to school vouchers.
Or at least that they're hinky about it and this is an alternative.
Agree with that?
Yeah, and there are a lot of, we've talked about this, there are a lot of Republicans in the House who are still skeptical of the vouchers program for a number of reasons. This EITC vote, as it's known, was seen as sort of a more politically palatable alternative. Got over to the Senate and landed with a thud with Jeff McCall, the Education Committee Chairman, the father of vouchers, GOP father of vouchers, declaring it dead on arrival.
All right, but the final word here is that this isn't going to hold up the budget.
No.
You think they're going to do the budget, and if they have to jettison school choice until the fall, they will do that.
The Senate Majority Leader has already said he thinks because of the House action that this will be put off. Vouchers will be put off to the fall.
Great update.
But shale impact fees, I think, are going to be a major.
Okay, good update. Patient-centered medical homes. We're going to find out about that. Boy, this is a new concept you don't want to miss. See you around the corner.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Patient-centered medical homes. I introduced this as a new concept. I'm hearing from our medical experts, well, a few little adaptations, right? You're going to tell me about that. Joining me is Dr. Robert Nielsen. He's with the Annville Family Practice. He's been on the program before, and the Senior Medical Director with Highmark, Dr. Andrew Bloschichak. Did I get that right? See, I'm getting better. I know, Madonna, it's not quite the same. All right, Doctor, look, what's this concept, and why should people care about it?
Well, it's, as we were saying earlier, it's not completely a new concept. The concept of a medical home, or components of it, have been around for, gosh, probably 40 years. But over the last couple of years, it's really built up some steam with endorsements by Family Practice Academy, Pediatric Academy, with literature that's been written about the successes. But essentially, it's from my standpoint, it's a transformation in primary care, in office practice. It includes the physician really leading a team in the office, but also it includes a lot of the IT, a lot of the electronic health record and use of the data on patients to manage those patients, with a focus on quality, access to care, and also a very important part is is a change in the reimbursement for patient care too.
Mm-hmm. All right, you're in the process of doing this now, right?
Correct.
Walk through it. Start out. I mean, a patient comes in and you're looking at the patient, and what would you say about what that means to the patient?
What it means to the patient is that we're going to try to focus on a group of people being involved in their care. So that I don't, in a typical 15 or 20-minute office visit, there are so many items to bring on the agenda. A patient has an agenda. They have their diabetes. They have their high blood pressure. We're trying to get their preventative health care done. They come in with a cold. Their family member has a question about how to get mom or dad to the next level of service. A lot to accomplish in a short period of time.
So they, in addition to seeing you, they would have 3 or 4 other people that would interact with them that would perform certain functions.
Sure.
And that's not so unusual, but is it the coordination of this that makes it unique?
Coordination, communication, and communications, yes.
Go ahead.
Yeah, we've enhanced the roles that nurses are playing in the office.
Right.
We have diabetic educators who are working specifically on that. We're taking a look at the demographics of our practice. We're thinking more about population health as well as the individual, that flock of people who call your practice home. How do they get their care? How well are their diabetes being taken care of? What are the outcome measures?
Right.
What's their access to your office? How often can they get in? Can they get in the evening to see?
These are all, I don't want to interrupt you, but these are all, it sounds to me, very significant in terms of how patients react to the care they get. I mean, is that right?
I agree. Although, when I first heard of the concept medical home a couple of years ago, it was actually through the Pennsylvania Academy of Family Physicians and some educational programs. And when they talked about we need to coordinate care better and such, my first thoughts were, isn't this what we do anyway? Yeah. But as you look into the details, and really the heart of it is in the details, that communication part between Dr. Nielsen's practice and a hospital if the patient's in there, and reducing emergency room visits or hospital readmissions.
So it has what you're saying is it has ramifications just sort of well beyond a patient walking into an office to see one of you guys, right?
Absolutely. I think
a good point.
How we communicate with one another, how we prevent duplication of services. How do we get the labs that were done at the cardiologist into our office charts so we don't order them again? There's waste in the system,
and it's I mean, I've obviously been seeing a doctor my whole life. I remember when I would go into the office, the doctor would meet me, we'd have this conversation. He'd do a test or two. Now, this is a hugely complicated world. I mean, with a battery of tests coming in, a battery of things that need to be done. I mean, and it's hard with all the patients that you've got to keep this all straight. So is there a coordinator of all this?
We do. In our office, we have 10 physician providers and a couple of mid-levels. Each one of our teams, we have 3 of them, will evolve to having a nurse care manager who will be involved in helping us look at some of the informatics, some of the output from the computer as to try to designate who's at high risk, who needs more services, to do callbacks to make sure that, Mary got the medications coordinated, did medication reconciliation, so many hospitalizations.
So it's just not, we're going to run to a break, but I have some other things I want to ask you. So it's just not walking in the office and having one of you guys see a patient and give a prescription and then you're out the door, right? Those days,
not anymore.
Those days are long gone. All right, this is not a new concept, but an important concept that the folks at Highmark are working on. We'll continue this discussion after we absolutely pay some bills.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program. We're talking about a medical home now. A medical home is not like a home where you live. It's a home where you go and get like a complete set of services. Do I have that right?
Correct.
I want to make sure I got that. Now, this care coordination is really central to this, and someone, go ahead, you know where I'm heading.
I agree. The care coordination piece is central, as is the electronic health record and the use of the electronic health record registries. But there's a lot of work being done before you as a patient even comes into the office, Dr. Nielsen's office. His staff, his care coordinator, care manager, will be looking over the data on diabetic patients, looking to see what their sugar control has been, if the patient needs one service versus another, and arranging for those services.
Yeah.
Would you agree?
Now this electronic, I want to pick, electronic record keeping. And we were doing shows on this when it came about, and I know how I write. You can't read it, and I know how you doctors write. I mean, you wrote. It's just really made some difference, hasn't it?
It's a huge difference, not only in recording data, but how you can get at data, how you can review data, and more importantly, how you can put the decision support system so that when you walk into the office and we're trying to figure out what preventative services you might need based upon your gender, your age, your medical conditions, we're able to get to that very quickly as opposed to trying to thumb through a chart. We can also then expand that to a population base. We take a regular look at our patients in our practice. We have 1,200 diabetics. 5 years ago, I couldn't have told you that. We can take a look at those diabetics who are under good control. Those who aren't under good control, we can call them up and say, look, let's get you in and see our diabetic educator, focus on that, so we can take care of the flock a little bit better.
What about reducing medical costs here?
That's one thing our pilot's going to look at, as well as the quality metrics that are attained in a medical home. There are studies that were reported of reductions in emergency room use because of the access, reductions in hospital admissions and readmissions. So there has been some studies written. We feel that we'll probably see the same. The governor's initiative has seen
keeping
the same
people out of emergency rooms. I mean, we all know that that's fairly expensive. I'm not blaming the hospitals for this, but it is fair, and people going there for things that they should be going to see. You. Am I right about you? You're on the front end of this.
Absolutely.
All right, we got about a minute left. What's the most change that's been the most radical or extreme, whatever word you want to use?
Number one, the use of the electronic record and beginning to develop some technology, and having patients interact with multiple care providers and getting them to understand that that's an okay thing, that we do communicate, that we do work together as a team, and that will enhance their care.
Yeah. Well, look, I want to thank both of you. I hope when this gets going, maybe you'll come back in a year or so and talk to us some more about this, and we'll see if this is a trend that grows. We'll see what, like all changes, and we'll see where it goes. All right, as always, thanks for watching this edition of Pennsylvania Newsmakers, and stay well.